I'm Colin West. I'm an Associate Professor of Medicine and Biostatistics and a consultant in the Division of General Internal Medicine at Mayo Clinic. The title of the article is Association of Resident Fatigue and Distress with Occupational Blood and Body Fluid Exposures and Motor Vehicle Incidents. Our paper, which will be published in a forthcoming issue of Mayo Clinic Proceedings, reports on the association of fatigue and several aspects of distress among internal medicine residents with resident personal safety outcomes, including exposures occupationally to blood and body fluids and experiences with motor vehicle incidents. In this study, we followed internal medicine residents at Mayo Clinic in Rochester, Minnesota over 4 years, asking them survey questions on a quarterly basis and also asking them about their experiences with blood and body fluid exposures at work and motor vehicle incidents, including car crashes, near misses, falling asleep while driving or in traffic. We studied more than 300 residents, and we asked them to report on their fatigue and distress at one time point and then tell us over the next 3 months through the quarterly surveys what happened in terms of subsequent exposures to needle sticks and car crashes. We found that occupational blood and body fluid exposures were relatively uncommon, affecting less than 10% of the residents in the study, which was a reassuring finding. Because these were so uncommon, we did not find very much in the way of association with resident fatigue or distress, which is a good thing for medical education. However, motor vehicle incidents, including car crashes and near misses, were quite common, affecting more than half of the residents in this study. And those outcomes were strongly associated with both fatigue, as we would expect. Tired residents and car crashes should not be surprising, but also strongly associated with distress factors, including burnout, poor quality of life, depressive symptoms, and so on. So how are these results relevant to medical education? They're important because they emphasize that although there are ongoing efforts to control fatigue, both for the benefit of patients and for residents themselves, these results suggest that we also will need efforts to control distress and promote well-being among our trainees. There's previous literature suggesting that physician well-being and distress are associated with patient outcomes. We've not had literature to date associating distress with physicians' personal safety outcomes. That is a new contribution of this work, and again suggests that for the medical education community, we need to begin to take steps to address well-being and distress better, not just for the safety of our patients, but to protect our residents. At present, the best strategies to promote well-being among physicians and residents specifically are largely unknown. Because of the impact of this on medical education, however, clearly the next step after this report is for the medical education community to prompt additional research into strategies to promote well-being for residents. We know from previous literature that this is important to help protect patients because distressed residents are more likely to be engaged in suboptimal care practices, but we now know that this is also important for the safety and well-being of our residents themselves. So it adds yet another motivation for developing approaches to maximize well-being for our physicians in our medical education environment. The take-home message from this work is that both fatigue and distress are related to important personal safety outcomes for residents. We've known this in the past from work at several institutions for the fatigue part of this, but we have not known this for distress. So now that we've added that to make the situation a bit more complicated, we know that current efforts to mitigate fatigue are likely insufficient by themselves if we have the goal of maximizing both patient and resident safety. That in addition to the current efforts to help with fatigue issues in training and in practice, we need to be focusing more attention on promoting well-being and minimizing distress among our medical trainees and likely as well among physicians as a whole.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.